Good afternoon. Welcome to the COPD Home Study Course, Video 1, COPD Basics. Thank you once again for joining me. I am Brian, the lung coach, and I'm here to teach you the fundamentals about COPD and what is actually happening in your body when you have COPD. Now, there's a couple of causes of COPD. We'll get more into the causes here in a minute, but just so you know, the biggest cause is irritation or pollutants getting into the lungs causing mucus and swelling, or also known as inflammation. So mucus and swelling are the two culprits that really make the changes in the lungs and give you COPD. Now, emphysema, which is one cause or one type of COPD, you've heard that maybe used interchangeably talking to your doctor. But what that is that your lungs, through that mucus and swelling, have taken deep breaths with your lungs over and over and over. And especially if it's caused by cigarette smoke, or if you work in a factory or a coal mine, or where you're getting constant inhalation of a pollutant or an irritant, something to cause mucus and swelling. And what happens over time is, as you take the deep breath to get around all that mucus and all that swelling, is your lungs start to stretch out, and they lose what's called elasticity or stretchiness in the lungs. And as that happens, over a long period of time of stretchiness getting lost, you can't exhale any longer, and then they call that emphysema. And the reason this is bad, because a little fact about your lungs is you breathe in oxygen, right, and you exhale CO2 or carbon dioxide. Now, many of you people know this, and it's a simple fact, but what happens with emphysema and that constant stretchiness is you get to a point where your lungs cannot exhale. They can't exhale that CO2. And this becomes bad because the CO2 builds up in your body. And this is the primary condition of COPD with emphysema, is you can't exhale, or you have what's known as hyperinflated lungs. They've just inflated over and over and over to get around that mucus and that swelling, okay? And over a long period of time, it's like a balloon. A lot of respiratory therapists and doctors like to use analogy with the balloon. If you blow up a balloon, it's kind of stretchy and it'll blow all the air out. And if you repeatedly inhale over and over and over, then that balloon will get stretchy and it'll lose its elasticity. So that's emphysema. The other type of COPD is called chronic bronchitis, and that's when the airways in your lungs, the bronchial airways, get inflamed. Like I said, swelling, and they also produce mucus. So I had bronchitis as a child. Children get bronchitis and from an infection, but with chronic bronchitis, it happens over and over and over, actually over about the course of 3 months for 2 consecutive years in a row, can start to cause bronchitis. So if you have a productive cough, mucus is coming up when you cough, and you struggle and have trouble breathing from inflammation, then it could be the start of chronic bronchitis. Now, a cough, a productive cough especially, where you're coughing up mucus, that's one sign and symptom. Another sign and symptom is wheezing. And I pulled up just an audio file on YouTube. You can just type in wheezing, and there's hundreds of them. And I don't know if you can hear that sound on my mic here. Maybe you can hear it, but now that sound is the airway being narrowed, constricted down from either swelling or mucus, or like in an asthma, it could be the muscle spasming. But anyway, the airway is narrowing, and then it makes this noise, wheezing, okay? Now, the wheezing happens because it's producing a little whistle effect as air is moving in and out a really small tube. Now, we give something called albuterol or a Duoneb or Venolin or ProAir, or what's called a rescue inhaler. And what that does is it dilates that airway a little bit. It relaxes the muscle, okay? And then if you take other medications like steroids or long-lasting bronchodilators, those also help open those airways up, okay? And that's the rescue treatment for COPD attacks, and we'll get more into that later. But right now, we're still talking about how often this COPD is happening, and really over 30 million Americans are estimated to have COPD in the country, so that's quite a few people. A lot of smokers who don't even know they have it yet. A lot of smokers live in denial. You know, it's not going to happen to me. Well, you know, the problem with lungs is if you constantly barrage them with trauma or irritants or pollution, they get inflamed because they're trying to battle that foreign body, that foreign object in your lungs, okay? Now, sure, some people genetically can smoke till they're 90 and they have slight changes. I would, argue anyone with that. But to be honest with you, if you're a smoker and you've been smoking for a long time, a pack a day. Now, if you smoke once in a while, social smoker, you may not have lung changes. But if you've been smoking a pack a day, which most smokers do, you may or may not have the first signs of COPD. Okay, but signs are you get short of breath. If you can't go up a flight of stairs, if you can't go to the bathroom, if you can't do anything without feeling short of breath, and it's accompanied by a productive cough, wheezing, and also you've been a smoker or you're exposed to something you're inhaling, okay? These are signs and symptoms of COPD. Hopefully you've already talked with this with your doctor. Your doctor is the only one who can diagnose the COPD, but there's some tests they can run. And hopefully if you haven't seen to the doctor in a while, I suggest getting in there, just talk to him once a year, especially if you're starting to feel short of breath. But basically, we talked about COPD and how that's emphysema or chronic bronchitis. A lot of this is caused by mucus and swelling and the constant need to take deep breaths to get around that mucus and swelling and that inflammation. That ends up causing lung changes, which become COPD, okay? And really, we could go into the genetic types of COPD. Alpha antitrypsin deficiency is a type, but if you have that, we'll get more into that later. There is 1 in 4 patients do have genetic emphysema without smoking or being exposed to environmental factors. So we'll get more into that on the future videos. But we are going to move on to the next videos, which is COPD medications. A lot of times people are already prescribed things, and it's the first line of treating COPD to help manage it. So that's in the next video. I'll see you there. Thanks for joining me, and I'll talk to you tomorrow. Good night.